Good morning, all of you. Today's topic for lecture is management of deep bite. These are my contents. Okay. Introduction, definition, classification of deep bite, etiological factors for deep bite, diagnosis, management, conclusion, and references. So, to understand the concept of overbite, we just have to know about for to understand the concept of deep overbite, we have first know about the overbite. What is overbite? Okay. According to Strang, the overlapping of the upper anterior teeth over the lower in a vertical plan is known as overbite. The amount and percentage of overlap of the lower incisor by the upper incisor is overbite. Normal overbite considered to be 2 to 4 mm. So deep bite is most commonly seen malocclusion next to the crowding. It can occur along with other associated malocclusion such as class 1 malocclusion with deep overbite and can say class 2 D2 malocclusion with deep overbite. Okay. So deep bite is a complex orthodontic problem that can involve tip, alveolar bone, maxillary and mandibular basal bone, and soft tissue of the teeth. In class 2 due to malocclusion, the condition was recorded in 1912 in the German literature Tagbis. So complete covering or concealment of the mandibular incisor crown due to excessive overbite and retroclination of maxillary incisor. Deep bite also termed as cover bite or close bite. As we can see in this image, this is our class 2D2 case where the deep overbite is present. Okay. The complete concealment of the mandibular incisor by the upper anterior tooth. Some definitions given by the Graeber. Graeber defined deep bite as a condition of excessive overbite where the vertical measurement between the maxillary and mandibular incisor margins is excessive when the mandible is brought into habitual or centric occlusion. According to Ravindranatha Rao, overlap greater than 40% should be considered excessive deep bite, as they have the potential to cause deleterious effect on the overall denture health of the surrounding periodontal structure and the teeth. So classification of the deep bite is classified into dento-alveolar deep bite, skeletal deep bite, true deep bite or pseudo deep bite, complete deep bite or incomplete deep bite. According to Eckerle classification, Eckerle classification classify the deep bite in type 1, 2, 3, and 4. In type 1, mandibular incisor impinge against the palatal mucosa. In type 2, mandibular incisor impinge into the palatal gingival margin of the upper incisor. In type 3, both maxillary and mandibular incisor incline lingually and impinge on the lower labial gingival and upper palatal gingival spine. In type 4, mere facet of the palatal surface of the maxillary incisor and labial surface of the mandibular incisor due to impingement of the incisor over the one another is present. So, what are the etiological factors for the deep bite? Inherent factors like tooth morphology, the increase in the patient having macrodontia, tooth sizes increases. Okay. In cases where the generalized spacing present with the macrodontia, skeletal patterns, malocclusion, condylar growth pattern. These are the factors which can cause the deep overbite. Avoid factor like muscular habit, change in tooth position, and those of the posterior tooth can cause the deep overbite. So how can we diagnose this? We can diagnose the growth or consideration of the patient. If the patient is growing, growth is ceases or completed. Okay, so we can identify or we can diagnose the patient by the growth consideration. In certain patients, such a class 2 D1 patient with growing age having retrognathing mandible with presenting with a deep bite over there. So we can consider, we can assess the growth for the treatment of the deep overbite. Assessment of the vertical dimension. Vertical dimension is also assessed by the, we can go to identify the vertical dimension with the help of the lateral cephalogram. If there is a lower anterior facial height is increasing in the patient, so it is a case of deep overbite. Soft tissue evolution can also be a diagnosis process for the deep overbite. Further treatment objective of the deep bites, exclusion of the posterior, intrusion of the anterior teeth, combination of both, or either exclusion of the posterior or intrusion of the anterior teeth. Propionation of the incisor can also be used for the treatment of the deep overbite. Surgical treatment for the deep bite. These are the exclusion of the posterior teeth treatment, how we can see in the image that how we are going to correct the deep overbite by the anterior biting of upper anterior biting to intrude the lower incisor. The deep bite is corrected by intruding the lower anteriors. These are the removable appliances used for the certain deep overbite correction. In another image, we are seeing that this is myofunctional appliances such as screen block given in class 2 D1 case for the correction of the deep overbite as well. Class 2 D1 patient having overbite as well. Deep overbite is present due to the retrognathing mandible or horizontal growth pattern. There is a deep overbite in a patient, growing patient. So we can correct it by the use of the twin block or certain myofunctional appliances we can see in these images. Okay. Activator is used for the correction of the deep overbite. This is a plyometer is used. Okay. This is an extraoral increase system used when there is a vertical dimension problem or vertical deficiency in a patient. Okay. So we can use this cervical as a cervical headgear is used in this patient for the encourage purpose for the correction of the deep overbite by what? By intruding or retracting or distalization of the upper maxillary anterior teeth.
An anterior bite plate is most commonly used to correct a deep bite when the upper front teeth greatly.
So as we can see, this is the anterior bite plane. Okay, placed in the upper arch for the correction of the deep overbite by including the upper as well as the lower incisor. Okay, and correction of the deep bite is occurred. Okay. In certain methods, fixed appliances are used, such as utility arch used for the correction of the anterior deep bite. Okay, as in this image, we can see what is it? Utility arch used for the correction of the anterior deep bite. Okay, by including the lower anteriors. Okay. Lingual orthodontic is used for the correction of the deep bite. This is another case in which we are using the three-piece intrusion and reduction arch for intrusion of the lower anteriors. Okay. And in this case, deep overbite is present due to the class 2 D1 D2 relation, class 2 D2 malocclusion. Okay, where we are going to open the bite by the 2x2 appliance therapy. Another video is showing how we can go through the correction of the deep overbite by placing this curve be present in a lower incisor, lower arch. So we are using this utility arch or fixed, liver curve of the wire for the correction of the deep bite by intruding the lower anteriors. See how it is going to be corrected by intruding the lower anteriors. The deep overbite is corrected. Same as if there is a deep overbite present due to the extrusion of the upper anteriors, we can use the curve of speed upper arch. Okay, this curve of speed is given upper arch for intrusion of the upper anteriors. That's mechanotherapy. Okay, so that is mechanotherapy used for the correction of deep bite due to the upper anterior extrusion So this is intrusion of the upper anterior is done and the deep overbite is corrected by the fixed mechanism therapy. Another method we can use for the correction of deep bite by placing the utility arch. Okay. This video is showing you how we are going to this. This is a lingual arch given for the entrance purpose and the utility arch is placed in for the exclusion of the entrance. See how to exclusion of the lower entities for the correction of deep organ. Same using the upper. Okay. So correction of the deep bite with orthodontic and orthodontics and surgery. Orthodontics and interposition genoplasty, inferior only mandibuloplasty, mandibular advancement, total cervical mandibular advancement. We can, along with orthodontic inferior reposition of the maxilla and mandibular advancement, combine maxillary and mandibular surgery for the correction of the deep organ. So the some other method for the correction of the deep bite in a fixed mechanotherapy is by placing the implant. Okay, by placing the implant for the correction of the erosion of the for correction of the deep bite in the lower anteriors by intruding the lower anteriors. Okay, we are going to use this. Okay. Same we are going to use in the